Hey, you ever wonder how common your low back pain is? Believe it or not, it's very common. In fact, 4 out of 5 people on the planet have low back pain or have had low back pain. That's 80% of the population. In fact, in our office, most of our patients are low back pain, and the next one is cervical or neck pain. So why do we have this pain? Believe it or not, it's your lifestyle. It could be lifestyle, sometimes it could be also traumatic, car wreck, falls. So either we are not using our spine enough and being sedentary, or you're using it improperly for too long. Okay, so let's take a quick look at what the spine looks like. This is our spinal column. It includes our spinal cord, and it's protected by these bones, which are vertebrae, and in between the vertebrae are discs. Okay, so when you get wear and tear on your disc, it also affects the bones and affects the joints, okay? So what we're looking for when we do the exam is, are your vertebrae in place or are they misaligned? When they become misaligned, it's called a subluxation. And there's symptoms along with that. You put pressure on the nerves, you can have muscle pain, you can have swelling, you have all kinds of different symptoms. The other thing we look for is your spine moving correctly, or is it stuck in place? We call that a fixation. So next what we're gonna do is take a look at the muscles. This is a muscle right here. There's a lot of other muscles around. A lot of times people think that it's a muscle problem, when in reality it is a joint problem. You ever see people go to physical therapy, or they're doing yoga, or they're stretching, and the problem never really goes away? That's usually because of a joint problem. So how we determine that is through an exam and x-ray. Okay, so I'm going to take you around the office and show you what a first visit's going to look like, okay? So we're going to come up here to the front desk, and what you'll do is you'll fill out some paperwork, have a seat, and then when you're done, somebody will bring you back and we'll have a consultation. Okay, we're going to go into the consult room here. So in our consultation, we're going to have your health history, and I'm going to listen to your health problems. After that, we're going to move to the next room over, and we're going to do an exam and x-ray. Okay, so follow me into the next room. Okay, so why is it so important to do an exam? We need to find the root cause of the problem. So what we'll end up doing is an orthopedic test, a neurological test, do some range of motion, and then also we're going to come over here and do our posture analysis to see what's underneath your skin. Okay, so next let's take the x-ray. We're going to come into the x-ray room. What's so important about an x-ray? Well, you and I both want to visually see what's going on in your spine. We want to see if you have misalignments or if your vertebrae is stuck. So this is the best way to see that. There's also other issues we can see on x-ray, so it's very important that we do this. And then when we're done here, what we're going to do is reschedule up front, and then we'll see you on the next visit.